I would thank the witnesses for coming, being a part of this dialogue. This is in your lap in a lot of ways as far as implementation. You're the one on the phone trying to get answers, writing letters, trying to get answers, dealing with the implementation on the ground, and many of you will be on the first line of that phone call trying to be able to get things resolved. In my state, they gathered all the state leaders together last week from all the different agencies that have any connection, and they had a long list of all the unanswered questions, and so they want to get everyone together so they could pool it and find out what everyone knew and get all those answers so everyone could share it. What they did instead is they got all the state leaders together, listed the questions, and none of them had the answers. All of them assumed someone else knew this and they just weren't sharing it. None of them knew what's going on. And so again, the focus of, gosh, this is going to be great, is very different when you have to implement and when it's coming at you and the questions come to you. I would commend to anyone's reading on this committee and outside this committee the Navigator report that was done by this committee, dealing with the issues of fraud, dealing with the exposure areas that we have that are a real risk to consumers. I mean, we've had a hearing on the Data Hub to ask some of the questions that should be asked about security because a lot of Americans' information is about to be exposed. But with the Navigators and all that's happening in the days ahead, and as we have seen the reduction of time that's now required in their training and what is there are serious issues. We do have, and I know Ranking Member has mentioned, we're 38th in the world in health care. I would say in my district in central Oklahoma, we have more advanced cancer care in Oklahoma City than in all of the UK. We had a hospital open in Oklahoma City that is a straight fee-based hospital, and they were surprised to see that the first thing that happened was that Canadians started coming for health care. 25% of their business are people from outside the country that come to that hospital from all over the world. And when people are sick and they need advanced care, they're coming here to get that. The term medical tourism didn't exist years ago, but now many of our communities see it as some of the finest hospitals in the world are located right here. And the challenge is, do we put that medical advancement at risk by limiting reimbursements, limiting access to that, controlling how it's done in the days ahead, and so that the medical innovation that is currently occurring slows down, and that we suddenly become equal with the rest of the world rather than leading the rest of the world in medical innovation and device manufacturers and drug developments and such. We have to continue to press onto that. This is a bill that where there are major problems. I've heard over and over again, it's the law of the land, we should just leave it. We are not doing that with No Child Left Behind. We see that there are major issues on implementing that law, and we've now reached a time where almost every state is under a waiver. No one here is saying we need to implement all of No Child Left Behind. It is the law of the land. We need to demand every part of that is implemented. Why? Because there are major problems with the law, and we can see it based on how it's implemented, and so waivers have gone everywhere to try to free everyone up from what's happening in No Child Left Behind. We're seeing the same thing occur with the Affordable Care Act. Waivers for employers, waiver for certain people, waiver for certain group, because the problems continue to double up on this. Right now, the House and the Senate are dealing with what do we do to replace No Child Left Behind, because it's become such a problem. And in the days ahead, we will finally come to a point of saying there are so many issues and so many problems with the implementation, we have got to look again on what do we do to replace this. I look forward to the day when states are allowed to experiment, as my state now has to come begging to the Federal Government to do things to take care of the needy in my state. As a program called Insure Oklahoma, which has been a fantastic program to be able to serve people in my state of great need, which we continue to expand, now we have to beg to allow that program to continue to go forward. When health care is controlled from Washington, D.C., it's about numbers. When it's controlled in state and local areas and counties and districts with great need, and I have many rural districts in my state, it's about neighbors, and it's about families and real lives. So at the end of this day, hopefully we brought some questions to the table that we can get a resolution on, and hopefully we can continue to focus on families and lives. Thank you again for being here and for being a part of this conversation. With this, we are adjourned.